Hi, and welcome to What's Happening at Tri-City Medical Center. I'm Kelly Davis, and I'll be your host for this series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local hospital and provide you with information for a healthy lifestyle. With us is Dr. Adib, a board-certified OBGYN practicing at Tri-City Medical Center after extensive training and experience abroad. She is here to talk about women's health and to answer questions about annual exams. Welcome, Dr. Adib.
Thank you so much, Kelly, and thanks for having me here.
The first thing I want to do, you have such a lovely name, and I didn't want to butcher it. Could you please say your full name for us?
Sure. I am Tannaz Adib.
What a great name.
Thank you.
So, Dr. Adib, my mother used to tell me when we're talking about preventive care and gynecological visits, way back before I would even see one, she was telling me as a child some of her, what her information she had as a woman growing up in South Carolina. So I always had to take a little bit of a grain of salt with what she said, but she would say things like, pay attention to that area. Make sure that you don't wear underwear when you sleep at night so you can have it breathe. You know, wear socks on your feet to keep yourself warm. Are these just wives' tales, or is there something true to this kind of thing?
There is definitely some truth to that, Kelly. If women wear tight pantyhoses and tight pants at all times, then the area will be kept moist and warm at all times. And warm, moist environment is the best to invite yeast. So they're more prone to get yeast infections. So that's a very good idea indeed. So your mom was absolutely right.
Well, that's good to know. She certainly felt that she was right, so that's good. So how often, now gynecological visits, how often we as women should we be going?
At least yearly if there's no problem. But if there's any problem, the doctor will let the woman know what is the time of the next visit.
And do women who are done with childbirth or have undergone a hysterectomy, and please for our audience let them know what a hysterectomy is, does that change for them?
Not really. I'm so glad you asked this question, Kelly. A lot of women think if they're done with childbirth or if they have removed their uterus, which is called in medical terminology a hysterectomy, they're done and they don't need any more annual exam. But it's absolutely not true. The first time to start with an OBGYN visit is at least 21 years old, or at the first time that they become sexually active, whichever comes first. But they need to continue annual visits with GYN doctor, and there are different reasons to that. Number one, if someone has removed their uteruses and they don't have their cervix, maybe they don't need a pap smear in some specific cases, but they still need that annual breast exam and also annual pelvic exam. If someone grows a tumor in their ovary, which the most common age is 50 years old and up, there's no way they would know unless that tumor gains considerable size, and starting to treat that at that point would be a lot less successful. Also, women who are done with childbirth for the same reason, they definitely need to continue their visits for OBGYN. A lot of ladies, I've had a lot of patients that went through menopause and for some reason, for a disease or underlying pathology, they bled a little bit. And they thought it's normal, or they told me, oh doctor, I got young again and I had another period. My neighbor said that's okay, but that might be the first sign of cancer. So we need to be very vigilant on that. So when I said yearly, that means that everything is good. There's no changes or no problems. But as soon as women notice any changes, any discharge, any unusual bleeding that is not supposed to be there, they need to definitely make an appointment and come to us.
Wow, that's definitely fascinating. And also with women who practice abstinence, for example, they should also be going, just because you're not having, this is not something just because you're having sex or not having sex. Is that true?
Very true, Kelly. Women who are abstinent or women who have sex with the same sex still need to do their annual visits because other things might be going on, as I said, in their tubes, in their ovaries, or in their breasts.
And women who already gone through menopause, what about those, that category as well?
Right. The common age to start getting cancers is about 50 years old on average, and that's around the time that women go into menopause. We know that pap smears are the best way to screen cervical cancers. So even though they're, of course, done with their childbirth, they still need to come yearly to the doctor to get their pap smears done and also to get a pelvic exam to check other organs beside their cervix.
So let's change gears just slightly, since we're talking about these visits, and a lot of women may come. Yes, they might have maybe I think called it STIs now, or I don't know if the proper, or STDs, and just checking up. But what about the women who might think that they're infertile, and what does that mean, infertility? What is that?
Very good question, Kelly. I've had ladies who came to me for different reasons, like pelvic pain, unusual bleeding, and they didn't have the courage, or they were embarrassed to tell me, hey doc, I'm trying to get pregnant for 3 years now and it's not happening. They just come to me for other reasons. But by definition, infertility is when people have unprotected sex for a year and pregnancy is not happening.
Okay. And is there an age range that a woman should be concerned about, you know, can I get pregnant, future pregnant?
Yeah, it's a known fact that after 35 years old, Kelly, the fertility levels or fertility capability reduces gradually. But in the modern world, since a lot of women are into getting professionals first and they focus on their career first, I've had a lot of ladies who started thinking about their family or childbearing in their early 40s, and it's still doable if they come to a doctor beforehand and make sure they're getting checked and they get whatever that is needed beforehand. Also, the 1 year time that I said, that applies to people that are below 35 years old. If a woman is above 35 and they tried for 6 months and it did not happen because the clock has already started ticking for them, they need to come to GYN.
We have about a minute. What can be done for infertility? I hear about this in vitro fertilization. What is that, the only thing? Is there other things?
Yeah, actually a lot of doctors, as soon as they hear that from their patient, they automatically refer them to IVF, which is tens of thousands of dollars, which is normally not covered by insurance. Lots of invasive procedures and lots of hormones loads on women. But before doing that as a last resort, there are lots of things that can be done by the doctor, like a whole workup to find out the underlying reason. And sometimes the underlying reason is so simple that it can be corrected and the woman can conceive on her own.
Thank you, Dr. Adib. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.
Tri-City Medical Center, a leader in advanced healthcare close to home. Meet former NFL and 3-time Pro Bowl player Willie Buchanan. He retired after a decade in the NFL, but not before it took a huge toll on his knees.
I was in so much pain that eventually I wasn't able to do a lot of activities.
Willie realized that surgery was probably his last option and researched extensively who he would trust. He chose Tri-City Medical Center's Dr. Helgager, who performs about 200 total knee replacements a year.
Willie was experiencing severe pain from bone-on-bone wear in both knees. After consulting with him, his best option was knee replacement surgery. I knew this surgery could give him back his quality of life.
The surgery took less than an hour. I'm now pain-free and back to my daily activities, which include doing what I love best, playing golf. I'm so thankful for Tri-City Medical Center. and their doctors.
Willie is just one example of how Tri-City Medical Center is dedicated to getting you back to doing what you love. Tri-City Medical Center, advanced healthcare for you.
Hi, welcome to What's Happening at Tri-City Medical Center. With us is Dr. Adib, a board-certified OBGYN practicing at Tri-City Medical Center. She is here today to talk about women's health and urinary incontinence. Welcome, Dr. Adib.
Thank you, Kelly, and thank you for having me here today.
Well, first question, what are some of the reasons for leaky urine?
Yeah, there are multiple factors into play. And the first and foremost factor is aging, of course. The second one is childbearing. People who had many kids and larger kids and pushed longer time for the delivery, they're more prone to have a sagged bladder and leaking of the urine. Also, genetics plays a very important role. I've had ladies who had only one kid with 3 degrees of sagged bladder versus another woman with a better and a stronger connective tissue genetically, and they have 1 degree of sagging of the bladder. So these are the main factors into play. But of course, there are some underlying medical conditions for the patient that make them more prone to get a sagged bladder and leak urine. Like if someone has COPD and they cough all the time, with each coughing, they sag down more and they kind of make it more prone to happen faster. It just accelerates it. It happens anyways with age. We are upright situation in like about 16 hours in 24 hours. So gravity pulls it down all the time as we age. But another predisposing factor is when people are overweight. Obesity itself and overweight pushes it down more than it would normally get by aging.
So older women are more prone because of, I don't want to say gravity, but just because of what? Why are they more prone again? Let me just
because just the time passes,
okay.
and as time passes, as we age, our connective tissue sags down anyways, and also the gravity works on our organs constantly when we are in the upright position. So as we age more, there are more hours that our pelvic contents are exposed to that gravity.
Now, I heard, goes back to all these things you hear and then you get on the internet, is it true, is it true? I heard that you can use sit-ups or they encourage you to do sit-ups as a woman to help not just your back to help carry you, but also help with your bladder. Is that true?
I believe you mean Kegel exercises, Kelly. And if the degree of sagging or leakage is minimal to moderate, Kegel exercises may work. So the way women can do Kegel exercises is to constrict their inner muscles. And just imagine if someone is sitting on a toilet and voiding, and the exact muscles that will stop the voiding are the exact muscles that women need to contract to do Kegel exercises. So they can do 30 sets in the morning, 30 sets in the afternoon, hold it like 2 or 3 minutes, release 1 second, hold it again 3 more seconds and release. So 30 sets. And it may work in, as I said, mild, but higher degrees of sagging or leakage, probably Kegel will not work.
So, and you're saying it helps with urine leaking, but I guess it would help strengthen as well the vaginal walls as well?
Absolutely. It kinds of tones up all the pelvic muscles, and it's helpful in general.
Okay. And so this was one of the things that can be done, certainly. What else can be done to help with this urine leakage?
The first thing would be to avoid all the conditions that will accelerate the process. Like if someone has a job that is involved with heavy lifting all day long, they're more prone. So if there's a way to do that less often, I know it's easier said than done, but that will help to have this problem later in life rather than sooner. Also, constipation is another correctable factor. If people are constipated, and just the small stool softeners will delay this process. Of course, we can't do anything for aging, but there are two different kinds of, actually there are five different types of urinary incontinence, to be more exact, but the most two commons that most of women get it is stress urinary incontinence, which happens with laughing, jumping, or like change of position. And the other one is urge incontinence. That has nothing to do with positional cough, laugh, sneeze thing. That's just an urge to pee, and women may even have accidents if they don't get to the bathroom soon enough. So for each underlying reason, there's a different treatment. Like for urge, Kegel exercises will not really work. So a doctor will exactly determine after interviewing and examining the patient what type of incontinence is involved and what is the best way to deal with it.
So something like, let's see, this bladder sling or a mesh in treatment, what are those things, and are those kinds of things the items that you would use for a more, I don't know if the word is severe case of urine leakage?
Absolutely. They are very, very helpful modalities that we got them recently. And I want to use this opportunity to inform all ladies, because I'm sure we all have seen advertisement on TV. If you've been injured by this mesh or such and such, call us. So it's a common misconception, I want to say, that the meshes are not good. But in good trained hands, they really can change the quality of a woman's life. For higher degrees of leakage, if it's due to sagging of the bladder or the bladder neck, the best thing to do is a bladder sling to hold it up. We used to do that with stitches only. And in the best trained surgical hands, the dissolvable stitches would kind of dissolve, and women were in square one within 7 to 10 days with the best, exactly. But the mesh is made of propylene, and it's not dissolvable, and it's made like fenestrated. It has holes in it, and the patient's connective tissue grows in between the pores in the mesh, and it somehow intervenes, and it makes such a strong support for the bladder that it's life-lasting. So in good trained hands, it's really a good modality, and I want women to talk about this to their doctors. It's just like about saying that cars are not good. Yes, in 2014, about 33,000 people died of car accidents, but it doesn't mean that we shouldn't be driving. We shouldn't go to driving classes. Same thing, meshes, if used in trained hands, and the candidates are the right candidates, it's really, really helpful, and it's really changes the quality of life.
So bladder slings and mesh, this is something that you personally do in your practice?
I sure do.
Okay. Thank you, doctor. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.
Tri-City Medical Center, a leader in advanced healthcare close to home.
When I first came to San Diego and needed a doctor, I found Dr. Ferber.
That was 30 years ago, and since that day, Dr. Ferber has cared for Kathy, her husband, and their 2 children.
Our family has followed Dr. Ferber just so that we could keep him as our doctor. He's so compassionate and up on the latest health issues and advanced technologies.
Over time, they've dealt with some stressful medical concerns.
I don't know how we'd have gotten through our healthcare issues if it weren't for Dr. Ferber and Tri-City Medical Center.
It is my goal to empower patients and promote healthy living. It is an honor to be entrusted with their care. It's all about relationships. We are partners in their health.
Dr. Ferber has always been so accessible. You always feel like you're his only patient. He just really cares.
What I love most about my practice is that we become family.
Tri-City Medical Center, advanced healthcare for you.
Hello and welcome to What's Happening at Tri-City Medical Center. With us is Dr. Adib, a board-certified OBGYN practicing at Tri-City Medical Center. She is here to talk about vaginal and facial rejuvenation. Welcome, Dr. Adib.
Thank you, Kelly, and thanks for having me here today.
Oh, it's wonderful. Okay. Wondering if we could have both on the same day. What is this, vaginal and facial rejuvenation you do in your practice? How does a woman begin to ask for these things? I mean,
yeah, that's a very good question. I mean, it's totally up to a woman to ask. I normally, after an annual exam, I ask them, is there anything else I can help you with? As you know, Kelly, the definition of health by WHO back in 1948 is a good state and healthy state mentally, physically, and socially. So when women come to me for an annual visit, I make sure that I address all the problems, and if I cannot address all their problems, I make sure I refer them to the right people who can address their problems. And one of them is how they feel about themselves, about their age, about their looks, how is their self-esteem, and what happened to them in life, in previous relationships or in their workplace, and how they feel it might be related to their success in life. So definitely I ask them, and I have actually, I believe there's a sign that if you like to talk to your doctor about it, if you're interested, make sure you bring up. So I do it in my practice.
I understand coming to your practice as a OBGYN doctor, why I would come, and I'm going to just put vaginal rejuvenation for aside just for 1 second, but I would never think to talk about facial rejuvenation going to a gynecologist. And now, is this just something specific that you personally do, or have I been missing out? Should I have been asking my gynecologist for some facial rejuvenation?
Indeed, different type of doctors do the training session as long as they're MD, and even some dentists might have done these courses, and they offer it. So, just doing the training courses and having previous experience with that, any type of doctor who is interested in those sort of treatments can offer them in their offices.
So it doesn't hurt to ask.
Exactly.
Now, I understand facial rejuvenation, vaginal rejuvenation. What do you mean by that? What is that?
Yeah. Well, after aging and also with multiple childbearing, the vagina may lose its strength or its previous shape. Same thing with external genital organs like the labia and external parts. They may get darker or change in shape, or just imagine childbirth like if you stretch a rubber band more than it could tolerate, and then when you release it, it'll never go back to what it was before. So same thing happens to vagina. It doesn't bother some people, but it does bother certain group of people, or it may affect their sexual life. So what we can do in these rejuvenation is to basically construct the vagina and make it closer to what it was before these incidents.
So vaginal rejuvenation is not only, it deals with actually the physical, some physical alterations to it, is that?
Yes, it does. Facial, though, it involves mostly injections. We can also do facelift. We'll get into that, I believe, shortly. But in terms of facial rejuvenation, we want to know what stage the woman is at right now. People who are very much into themselves, they prevent to begin with. We have 250 facial expression muscles, and the more we use them, the more the lines happens on our faces. I'm sure you are aware of people, or you know people who, when they focus on things, they just frown, and it's their habit. And this habit makes them have two big lines over here, and they're not even 30 years old, and it makes them look angry or frustrated all the time, which is not true, really. So those type of things, or preventative, can be done by injections. But when the lines are too deep, or it's too long from when the lines has happened, or the women are too old, then the injections may not work, and really a facelift will be the best option. So the best thing about rejuvenation is actually to do a consultation visit with the doctor and voice the concerns, and based on what stage they are at, then the best treatment will be offered to them.
And what are some of the kinds of treatments for facial rejuvenation, for example?
Right. There are, in the earlier stages, there are fillers available to fill in like the deeper lines, like the smile lines over here. They best are treated with fillers. The facial muscles that move, like the frown or like claw feet or bunny lines, they are better treated with Botox or Dysport, so they're injections, if the lines are not that deep.
And what are the kinds of treatments for vaginal rejuvenation?
Yeah, there are certain treatments like laser treatments, and also doing actually a physical surgical procedure to tighten up the vagina or remove the darker parts.
And when someone wants to come in for the particular process of the vaginal rejuvenation, is it because they've come to you and they're like, you know, things feel a little wonky down there and I'm not quite sure what it is? How do they, I don't know if the word is get diagnosed, but how do they arrive that it's something that can be rejuvenated as opposed to some other kind of condition that might be more, I don't want to say health oriented, but how do you know the difference between getting the rejuvenation, or that it's something more serious that needs a medical attention?
Right. Rejuvenation is actually not exactly a treatment, it's a matter of personal choice. So the patients are the best people who will judge, or maybe their partners. Of course, if I see something that is totally off, or like something that is health related, like a lot of sagging or a lot of loss of strength in the vagina, I'll mention to the patient, because as I said, some of them are even embarrassed to say anything about it. But if they're fine with it, then we'll let them live with it. If they're not fine, then always things can be done about it.
And before we go, is there any final words that you would like to give to your audience about this topic of women's health and annual visits and rejuvenations and all that?
Yes, I do. I want to message all the women about taking care of themselves. We normally give service to everyone and forget themselves. I see a lot of moms, working moms or single moms, that they are used to give service all the time and they totally forget themselves. And I really like them to look again to their lifestyles and cherish their life, cherish their health, and actually take care of themselves too, because what will happen most of the time, after they age a little bit and after they're done with whatever was their first priority, then they're left with depression, anxiety, empty nest syndrome. These conditions are about 9 to 10 times more common in women than in men. And that's because we just, give and we don't take as much. So my final words to all women on the planet is to cherish their health, their life, and think about their emotional well-being as well as their physical well-being, and always ask their doctor if they need anything or if they feel anything is wrong.
Thank you, Dr. Adib, for joining us. And if you are interested in finding out more information about women's health at Tri-City Medical Center, please visit tricitymed.org. Thank you for joining us on another episode of What's Happening at Tri-City Medical Center. To watch episodes, previous episodes that is, or other KOCT programming, visit our video on demand page at koct.org. We'll see you next time.